Hello everybody, and welcome to another episode of RN Cliff Notes. Today we're going to be talking about cardiac isoenzymes and other biomarkers. It's going to be really important that you can distinguish between those. It's going to really improve your understanding, and this is particularly important for those of you who plan on being emergency room nurses, right? Or working in the ICU or the CCU. Any of these critical aspects in terms of nursing, this video is absolutely for you. But even if you're in nursing school, this will fortify your understanding, right? Okie dokie. So I'm Cliff Davis, Associate Dean of Nursing, and for many years I've been teaching advanced medical surgical nursing, right? Preparing students to take the NCLEX, okay, and get that licensure. So here we go. All right, what are we doing at RN Cliff Notes? Our mission is to help students to see through larger concepts, and we do that by teaching you study smart strategies. Those things that stick in your mind, right? I mean, you can study for hours. You can read your book for hours sometimes, but sometimes it's information that's delivered to you with more power that makes it stick in your mind. And then at that point, what? It's not just something that you're studying and you learned it for an exam, but you learned it what? For the rest of your career, okay? All right, so this time we're numbering our papers, our devices, from 1 to 3. And here's what our question is of video. We want to see if you can identify 3, right? 3 of the cardiac markers. You know what, let's expand this. It doesn't just have to be cardiac markers. It could be other biomarkers. Let's go with that. Okay? So when a patient has an MI, myocardial infarction, right? Or as lay people would say, they had a heart attack. Okay? How do we go about testing cardiac markers? How do we do that? Right? And that's what you should have put on your paper, a couple of those different biomarkers. And notice we're going to be using cardiac markers, biomarkers, isoenzymes. We're going to use those words interchangeably, okay? So here's the next thing we want to show you. Jump right into our study smart strategy. Now, what are we doing when we're seeing if our patient had a myocardial infarction or a heart attack? We're testing their cardiac markers. Testing cardiac markers, right? And as we do that, if you just look at those letters, testing cardiac markers, that actually matches up with the cardiac isoenzymes, which would be troponin, creatinine kinase, and myoglobin, right? And what's very interesting about that is that is essentially the order. Troponin is the study that trumps the other studies. That's like the more specific, more reliable study. So TCM, testing cardiac markers, troponin, creatine kinase, and myoglobin. Alrighty? Yes. Alright, next. So now we want to look at the ranges for those. And boy, you get some really interesting numbers with this. Alright, so for troponin, 0 to 0.4 nanograms per milliliter. Then we've got creatine kinase, 22 to 198 units per liter. Then myoglobin is also in nanograms per milliliter, but that's 0 to 85 for myoglobin. Okay, we're going to come back to some of that in a bit here, right? Okay, so what are the 3 locations where creatine kinase biomarkers are released? The 3 primary areas that we see when we're looking at that, right? Okay, and right, here's how they break down. So isoenzymes are found in your muscles, and the CKBB, that one is found mostly in your brain. CKMB found mostly in your heart, and CKMM found in your skeletal muscles as well as your heart muscle. But now, as we go a little bit deeper, okay, now we want to do our study smart strategies on these specific biomarkers. So we said CKBB previously. CKMB, and CKMM. And here's how we're going to break it down, right? Study smart. When you see CKBB, what I want you to do is think to yourself, brain. CKBB having to do with damage to the individual's brain in one way or another. And CKMB, right, that actually stands for myocardial bands. That's what MB is for, myocardial bands. And CKMM, what I want you to think of when you see that is muscle. So CKBB, brain. Coming down what? CKMB, myocardial bands, the heart, right? They may have damage there. And CKMM, the muscles. So it's like you're moving in a straight line down their body, okay? Now let's highlight that a little bit more. Okay, so now, as we see our little figure here, and sometimes images help to deliver the point. Okay, so we got a little red over the top of that. That might be a little difficult to see in YouTube land, but the red there, red at the heart, red in their legs, going straight down. Okay, and right, here's a little bit more detail. Because when we say they might have damage to their brain, how? Okay, so how? They might have a brain injury. This could be caused by a motor vehicle accident, right? Where the person wrecks their vehicle, and unfortunately for some people, right, they may hit their head against the steering wheel or against the windshield inside of their vehicle. So brain injury. Another way, meningitis, okay? Abnormal cell growth. Particularly when we start talking about abnormal cells, we start to think about potentially cancer. Severe shock, stroke, or hypothermia. And of course, with hypothermia, right? In a freezing kind of situation, we got people who, are walking on ice in a river and fell inside, right? And they were submerged in the ice cold water. They could suffer brain damage from that hypothermia. Okay, now, CKMB, of course, heart attack. Or as we referred to it earlier as myocardial infarction, or MI. Inflammation of the heart muscle, right? When we say inflammation, this is where we start talking about the itises, right? Itis, okay, what? Inside the heart. That would be, what would you say? Endocarditis, right? What if it's the actual middle muscular wall there? You'd say myocarditis, all right, great. And then the outer layer of the muscle wall, surrounding it, right? What would you say? Pericarditis. So endocarditis, myocarditis, or what? Peri, like perimeter, going around. Pericarditis. Excellent. Okay? Now, other than inflammation of the heart, trauma to the heart, and heart surgery, of course, right? CKMM, muscle damage in your heart, brain, skeleton, after a crush injury, seizures, or muscular dystrophy. This is one of the reasons that troponin tends to be the more reliable study. Why? Because you could have skeletal muscle damage that can impact some of these studies to a degree. And in the past, we kind of relied on the CKMB kind of exclusively. But it wasn't the most accurate study to determine if the patient had a heart attack or a myocardial infarction. So years after that, right, troponin was developed. And that has proven to be a much more reliable study, okay? All right, now, the normal levels, okay? Now, CKMM, what, muscles? Hey, 100%. We work out, we take that type of muscle, right? That type of muscle suffers kind of, regular trauma. Not massive trauma, but we're exercising that, and that does a little bit of damage in terms of, even though it benefits our health. Okay, so 100% on that. Now the CKMB can be up to 3 to 5% above the total CK, 3 to 5%. So let's say you engaged in some rigorous exercise, right? And it challenged not just your body muscles, but it really challenged your heart. Well, after that intense exercise, your CKMB might jump up to as high as 3 to 5%. Okay, so yeah, your muscle in your heart was a little damaged and released a little bit, but as we know, that's the normal level. It's acceptable, right? Your heart will recover fine, no big deal. Now, CKBB, on the other hand, right? We don't expect jumps in that number, and something else is going on. That person, meningitis or trauma or something like that, that number, 0%, right? Okay, now, what I want to do is remind you of our medical magical numbers. If you didn't see our very first video as we were addressing that we consistently see these numbers, 3, 4, 5, and 7, right? We see them a lot, okay? For the years that I've been teaching, wow, they permeate a lot of your studies, and we'll demonstrate that in just a minute, okay? All right, now, what we're about to talk about are two of the most important biomarkers when a person has cardiac issues. So, and in this case, we're talking about the person's heart, right? So we look at that word heart. Focus on that, right? Because that's going to be pretty important here in just a minute. So we're talking about what? The CKMB and the troponin. All right, now, here's what we're doing. We're going to count the letters that spell out heart, right? So H-E-A-R-T, 1, 2, 3, 4, 5, right? And that lets us know how many numbers we're dealing with. Then what we want to do, right? We see that 5 is the highest number as we spell out heart. And we're talking about those cardiac biomarkers again, correct? Then now, what we're going to do is realize that what? As we counted up to spelling the word heart, we counted the letters, that 1 and 2 wasn't a part of our magic number sequence, but 3, 4, and 5 were. All right, so we can eliminate 1 and 2, but 3, 4, and 5 actually are. So we take this a step further, and we realize that, right, like we talked about earlier, the CKMB, its normal range is what? 3 to 5. Okay? Then the troponin, its normal level is 0 to 0.4. 3, 4, 5 in our most important biomarkers, right? Absolutely. We're going to work with that some more in upcoming video series. Hey, thank you guys for liking and subscribing. Especially you subscribers, right? Welcome to the family. All of you note takers, right? Thanks, guys. See you next time. Study smart.